But our big story today is the COVID alarm, which has once again been sounded in the country. This on a day when the number of active cases have risen to the highest level of 2021. Remember, these are the numbers that we are now getting in the country. Active cases 1,97,237, deaths 1,58,306, recoveries as you can see there at the moment. The COVID surge that's taking place in India at the moment, if you look at weekly cases, this is the surge that's taken place. The lowest was from the February 8 to 14 period when there were just 77,284 cases. Then it went up to 88,890 February 15 to 21st. Then it went up over a lakh between the 22nd and 28th of February. March 1 to 7, 1,17,000. But in the latest week, now they've climbed the 1,55,090 mark. That's the worst in 4 months. Now, this is very focused because there are certain states that are worst affected. So if you look at the states that are worst affected, it's clear that Maharashtra has the largest number. So almost 70% of the cases at the moment, 1,31,812, are in Maharashtra alone. So Maharashtra remains the worst at the moment. The other states, Kerala, where there is a gradual sign of recovery, but the number of cases, 27,537 at the moment, are the active cases. Active cases number 3 is Punjab, 11,942. The fourth case where state which is a worry for the government at the moment is Karnataka, 8,879. Cases are beginning to rise in Bengaluru in particular. And the fifth is Tamil Nadu, active cases 5,149. Remember, this is a state that's going to the election. So clearly, there are pockets of the country, Gujarat, another state, where there are worries being expressed. Now, that's not the only concern because night curfew is now being imposed in several parts of the country. The big question also is on the vaccines, because after blood clots were reported in some countries among those who took ASTRAZENECA's Oxford vaccine, which is Covishield in this country, many nations, especially across Europe, have suspended the use of ASTRAZENECA. India, as I said, uses Oxford vaccine made by the Serum Institute of India. How worried should we be? What does this mean for the vaccination drive? Milan Sharma gets you this report before we go to our special Doctor's Table.
It started with the death of a 49-year-old nurse in Austria due to blood clots, days after receiving a dose of anti-COVID vaccine. While Austria suspended administration of vaccine from a particular batch from AstraZeneca, Denmark stopped giving the vaccine altogether. Since then, many European nations have decided to err on the side of caution. Germany, France, Italy, Spain are the latest to join the long list of nations that have suspended the vaccine developed by Oxford University and produced by AstraZeneca. AstraZeneca has released a statement assuring safety. The firm says that a review of 17 million people showed no evidence of any increased pulmonary embolism, deep vein thrombosis, or thrombocytopenia in any defined age group, gender, batch, or in any particular country. The World Health Organization has also said there is no evidence of side effects and that the Advisory Committee on Vaccine Safety will be reviewing the data. The European Medicine Agency says there is no indication that vaccination has caused these conditions. It says the number of reports of blood clots in people who received the AstraZeneca vaccine was no higher than for those who haven't got the shot.
There is no indication that vaccination has caused these conditions. They have not come up in the clinical trials and they're not listed as known or expected side events with this vaccine.
Meanwhile, Australia, the United Kingdom and Canada are continuing with the AstraZeneca vaccine.
Several more countries have suspended the use of AstraZeneca vaccines as a precautionary measure. This does not necessarily mean these events are linked to vaccination. WHO Advisory Committee on Vaccine Safety has been reviewing the available data, is in close contact with the European Medicines Agency, and will meet tomorrow.
The Oxford vaccine is key to India's vaccination drive against COVID. Covishield, the Indian version of the Oxford vaccine produced by Serum Institute of India, accounts for the bulk of the shots being given in India.
In India, the government has said that no serious event related to a blood clot has been reported post-vaccination. And in India, about 2 crore doses of Covishield have already been administered, at least as first shot of the vaccine. With concerns being raised across the nation, will people now become hesitant to take the Oxford AstraZeneca and Serum Institute of India's vaccine here? Is the question we need to ask today. With Ashok Banot, Milan Sharma for India Today.
Let's then go straight to our Doctors Roundtable, where I'm going to ask the most frequently asked questions as the country possibly heads for a second coronavirus wave. Dr. Arvind Kumar, Chairman, Institute of Chest Surgery at Medanta, joining us. Also with us, Dr. Hemant Thakkar, consultant physician in Mumbai at several hospitals, one of Mumbai's leading doctors. Dr. Shahid Jamil is one of the country's leading virologists, internationally acclaimed. And Dr. Rajesh Parekh is Director of Medical Research at Jaslok Hospital, who's written a book also on the corona vaccine. So I'm going to come to you, gentlemen, with sharp, quick questions and hopefully sharp answers to all our frequently asked questions at the moment. The first one, is it time to review the Oxford vaccine? Why don't you take it, Dr. Jamil, because you're a virologist, you've been tracking this. Is it time to review the Oxford vaccine as some countries in the West are? You've muted yourself, Dr. Jamil. You'll have to remove the unmute button, sir.
Yes, I'm sorry. So I don't think so. If you look at what the European Medicines Agency was just saying in your clip, 17 million people have taken the Oxford AstraZeneca vaccine. There are 40 cases of blood clots that have been seen in people who have taken the vaccine. Mm-hmm. There is no causality. If you simply look at the random event of blood clots, the rate is about 1 in 1,000 people per year. Mm-hmm. If you translate the 17 million number, mm-hmm. that translates to just random about 150 per week. Mm-hmm. We are talking about 40 cases. Not significant, no causality, simply alarmist. There is no reason for us to suspend anything.
So you're saying what the European countries have done, we do not need to follow that. Am I very clear, sir? You're saying the alarmism is completely unwarranted. Am I right?
It is.
Okay, good.
It is.
Given that, you've already almost answered my second question, which I wanted to pose. Are the fears of post-vaccine blood clots real? Dr. Thakkar, have you had any case or anyone come to you complaining after the vaccine of anything mildly resembling blood clotting?
Not at all. Not even remotely resembling blood clotting. And I completely compliment Dr. Jamil for the statistics that he has given, which will not interest too many, but this is absolutely minuscule. I must add that the incidence of thromboembolism in the routine population is even higher than what has been reported in these 40 cases. And it was these very countries, the Scandinavian ones, that flagged off the Pfizer flag when there were some deaths following Pfizer, and then the cloud moved on and the skies became blue for Pfizer. I think as far as India is concerned, our skies are always blue and will continue to remain blue. This is only a storm in a teacup.
Storm in a teacup. Okay, that's again very reassuring to hear. The next question that I have, which is coming, is should any precautions needed, are there any precautions specifically needed to avoid blood clots or any after effects after taking the vaccine? Dr. Arvind Kumar, any precautions that you've been advising your patients to take when they go in for a vaccination?
Rajdeep, thank you very much for having me on the show. First, I would compliment both the co-panelists and totally again echo what they have said. Number one, the incidence is extremely low. Number two, as it is, if you analyze the population, their population has a higher incidence of these problems, thromboembolism, because of various reasons, one of them being the old age where this problem is known to occur. The other being people in the bed, those who are in nursing homes, confined to bed, because that is the population. Elderly person confined to bed most of the time is the population which has highest chance of getting thromboembolism. We don't know how many of these people who have got, after taking vaccine, they went and lied down in the bed for next couple of days, which actually led to this clot rather than the vaccine. We in our country have administered close to 3 crore dosages, majority, nearly 85-90% of which is Covishield. And we are yet to see a single case of thromboembolism which has been reported in this population.
Okay.
And this is a huge number. So I don't think, other than carefully looking at the data which will emanate from these countries, I don't think we need to take. We advise all our patients to drink plenty of fluids, to take analgesics, antipyretics, crocin tablet when they have fever, to take good food and be active. If they have fever, they should rest. Elderly people should be advised to keep moving their legs, because if they are bedridden, not moving legs, they are more prone to have thromboembolism.
Okay.
Otherwise, no specific precaution, and we must continue vaccination, please.
I'll come to that in a moment, because I think all of you are giving very reassuring signals at the outset. Dr. Parikh, you want to add your word? Is there any precaution needed at all on this entire issue of blood clots? Do you believe it's grossly exaggerated? We've got countries like France, Italy, Spain, the big European countries all pausing the rollout.
Well, I concur with my panelists up to a point. I am not 100% reassured, and I'll tell you why in a moment. I was hoping to look at the data comparing different vaccines in terms of blood clots. I'm also waiting to look at age-matched data. A lot of young people are getting blood clots. But having said that, the data that I have looked at so far is reassuring. I do not disagree with the figures presented by my co-panelists. But keep in mind, Rajdeep, that the scientific bodies of several countries have scrutinized this data. And while they should have been more transparent in giving their reasons, they have paused the vaccination. There clearly is no indication for us to pause our drive. But I think there is a cause not for alarm, but for some concern when scientific bodies have advised against it. The CDC hasn't. In our country, we go on. But some of us who are involved in medical research need to keep monitoring this data and also slicing it in a different way to do a inter-vaccine comparison.
Okay, let's then come to, I think overall the sense we're getting, and this is for our viewers, don't worry. This is not, let's not be alarmist, because some countries have suspended their vaccine rollout of Oxford ASTRAZENECA. There is no evidence on the ground, as of now, at least in India, to suspend the rollout. Let's turn to my next question, or the next focus I want to do, as to whether people should take anticoagulants when they take the vaccine. Why don't you take this, Dr. Thakkar, because you're our physician, you can explain. Should we be taking anticoagulants? A lot of viewers are asking this while taking the vaccine.
All of my patients who have been on antiplatelet agents, what people misconstrue as blood thinners, we have continued them on it. And those who are on anticoagulants also, within limited reason, we have continued them on it. But there is absolutely no indication to say that if you are going for the Oxford vaccine, you need to take a blood thinner. Not in the least. There is no prophylaxis of this nature required at all.
Okay, that's again reassuring in a way. Let me come to you, Dr. Jameel, as our virologist on the panel. The serious side effects to look out for after vaccination. We're seeing several vaccines now being used across the world, both the mRNA vaccines and the vaccines that we're using in this country. Is there any pattern that you've detected in terms of serious side effects that should be looked out for after the vaccinations are taken?
Well, the most serious side effect after any vaccination is something called anaphylaxis, which happens within minutes. And that's why you are asked to stay at the vaccination site for 30 minutes. Beyond that, it's the regular fever, fatigue, headache, redness at the site. That's it. I mean, nothing serious has really been reported. If you look at India's data, in India, 234 people out of 3.3 crore who have received the vaccine have been admitted to a hospital. And coming back to the earlier problem about blood clots, not a single one of them have shown blood clots. So this is really a minuscule number. No vaccine, no drug is 100% safe or 100% effective. We all look at risk versus benefit. And today the risk versus benefit is much in favor of taking the vaccine because we are going still in the middle of a crisis.
Okay, so in a sense, again, I'm glad to see the reassurance coming in from you, doctor, because I think a number of people panicked when they heard the news that's come in from the West. An interesting question that Dr. Arvind Kumar, I want to take to you, because I'm told a couple of doctors in your hospital also have suffered, because can somebody get infected despite taking both doses of the vaccine? This is an important question. Can somebody get infected despite taking both doses of the vaccine? I'm told a couple of doctors have been infected at Medanta, but in general, do you believe people are safe after taking both doses, or should they still be cautious?
So two things, Rajdeep. One is that just taking first and second dose doesn't mean that you are protected. As per the advisory given by the ministry and also from the vaccine manufacturers, the real immunity is supposed to come about 2 weeks after the second dose. That is when the antibody levels peak. So I think you have to wait up to second week after the second dose. That's one. Number two, if you look at the efficacy figures, whether it is reported as 90% or 80% or 70% or some quote as 60%, let's take a round figure of 75%. So 75% people are getting protection, 25% may still get the disease. And therefore, as doctors, we have been saying regularly, just one dose of vaccine means nothing. Second dose of vaccine also you have to wait for 2 weeks. Then you are in that 75-80% protected category. But 20-25% or 10 or 40, whatever the figure is, there is a figure where people may still not develop antibodies and therefore may get the disease. And hence, till we reach herd immunity level, we all need to continue to have what is called COVID appropriate behavior.
You know, does anyone want to jump in there? Does anyone have a different view on this entire issue of getting infected after taking both doses?
Not on the issue of getting infected,
yes, go ahead,
because
Pai.
I think that has been, not on the issue of being infected, that has been explained very clearly that getting 2 doses doesn't necessarily insulate one. Just a bit I'd like to add that some of the mutations in the virus, particularly the Brazilian and the South African variants, are known to dodge the antibodies produced by some of the vaccines. And that's a thing to keep in mind, because there are mutants going around and we won't know which mutant it is unless a whole genome sequencing is done, which is a somewhat complicated process.
Are those mutants in India, according to you? Are those mutants already here? Are those strains already here with us?
No.
Absolutely. There was one reported in Delhi today. But Rajdeep, there's something else I'd like to add, and I'd like my co-panelists to correct me if either my observation or my conclusion is incorrect. As I was watching your show, something caught my eye in the visuals that you showed, and that was the technique of vaccination. You know, we were taught that the right way to give the vaccine is, once the needle is inserted in the muscle, to aspirate, that is to pull out a bit, to see if there is any blood drawn, to ensure that the vaccine is going in the muscle and not in a blood vessel. In 2 of the visuals, which I'm sure you all got from somewhere else, one of them in India and one abroad, in both of them, through the corner of my eye, I was astonished to see that no aspiration was done and the vaccine was injected directly into the muscle. That, I believe, poses a slight risk of the vaccine going into a blood vessel other than a muscle. But I am open to correction.
Dr. Thakkar, I heard you say no. Do you want to respond? Was there something that troubled you at the moment about this whole issue of infection?
No. When you mentioned about mutants, theoretically, he's right absolutely that mutants can partially dodge the antibodies that have been created. But we don't have those mutants in large numbers. I don't want to throw a scare amongst my population and my patients that we have mutants. But your question which you asked answered both the problems that we are facing. That there is a false sense of security amongst people who have taken the vaccine.
Right.
And that is the problem that is occurring. And your second infection which you test is because you have, as he rightly said, 75% efficacy. So you can get the infection again,
Right.
but it will be such a mild infection because your antibodies will tame it. You will not need to be hospitalized and you will not need to have serious problems. So I am not worried so much currently about mutations.
Okay.
Theoretically, what Dr. Parikh says is right.
Okay, let me come to the next big question, and this is a question which is now being debated across the world at the moment in the medical fraternity. And Dr. Jamil, you're perhaps best placed to answer this as a virologist. Should the gap between the two Covishield or Oxford AstraZeneca vaccines be 28 days or 8 to 12 weeks? A report in Lancet suggests that it should be 8 to 12 weeks. In India, it's being done I think, at 28 days across hospitals between the first and second dose. Is immunity greater the longer the spread between the first and the second dose, doctor?
It's a little more nuanced than that. The report in Lancet is a meta-analysis of 4 Oxford AstraZeneca vaccine clinical trials, one of which was the low-dose, high-dose trial, which should never have happened, should never have been taken into account. It was a mistake. Secondly, if you look at the results in that paper, which is really an observational analysis, it's observation of 4 different clinical trials, the confidence intervals are very wide. The data, if you analyze it carefully, looks very strange. So on the basis of that, in a country like India, where vaccine supply is not a problem, I'm not willing to, say that delay it to 8 to 12 weeks.
So you're okay with 28 days? So you're okay with 28 days? You believe 28 days will give
I'm okay
sufficient?
with 28 days, but let me just highlight one point, that at this point, we don't even know what the best protection means. No one knows this. The vaccines have not been tested for efficacy long enough. So if I am asking people for best to be the enemy of good, that's not the right approach.
No, so
get vaccine into as many people as possible. We are on an upswing right now.
No, the reason I'm asking you this is that, does that mean, Dr. Jamil, that we still don't know that even after taking my 2 doses, how long will I be immune for?
No one knows this. Who knows this? Post-vaccination data is just not available. Clinical, efficacy of clinical trials has been determined over a 2-month period.
So you're not willing to even tell me, so am I being told that even after taking my second vaccine, I am not reassured that I will not get COVID-19 for 3 months, 6 months, no time frame can be put?
No one knows this. No one knows this. And that's why it's important for us to keep wearing masks. And that's why everyone keeps saying, please, even after you take the vaccine, wear a mask. It's very important.
That was my question, Dr. Thakkar. Should people continue to wear masks and follow social distancing even after taking the vaccine? We've just seen in Ahmedabad 2 days ago, an entire cricket stadium was chock-a-block. Many VVIPs were not wearing masks. I was in Mahabalipuram 2 days ago shooting a story. There were over 1,000 people on the beach, very few of them with masks. Are you saying that even after taking your 2 doses, you must wear your mask and follow social distancing?
Absolutely. Because if you don't wear the mask, those esoteric bugs which might come and get you will produce some kind of infection. True, like I said before, after 2 doses, you will get either infection.
Okay,
forget the fact that if you get infected, so you have to wear the mask.
Okay, so the COVID protocol continues. Dr. Kumar, you want to jump in on that? Do you believe that is one,
Yeah.
you know, a sense of COVID fatigue has crept into this country? And a number of shopkeepers I spoke to in Mahabalipuram said, COVID is a rich man's disease. They said, you people are talking about COVID, I want to protect my livelihood. And many of them said, we are okay, we are, we don't have masks and we haven't got COVID. What would you say?
I would just give 3-4 very clear messages, because this program has to give a very clear, reassuring message to people. Number one, as of today, the 2 vaccines that are available in the country are our best option to fight COVID. So whenever indicated, whoever turn is coming, they must go and take the vaccine as per the schedule recommended. Number one. Number two, taking 1 dose or 2 doses of vaccine does not mean that you've got 100% protection. 2 weeks after the second dose, you are likely to have about 70% protection, and the rest of the people, the data shows that even if they get infection, it is likely to be a mild infection, not requiring admission. Nonetheless, that does not mean that we become complacent. Our best protection for this, for several months, will continue to be wearing masks, maintaining social distancing, hand hygiene, and fourth, but most important, not accumulating in large numbers in closed spaces. Recently, I have seen people organizing birthday parties, marriage functions, other functions where hundreds of people accumulate in one closed hall with AC. That is a sure shot invitation to disaster and must be resisted if we have to control corona.
Given that, Dr. Parikh, can we, given what all of you have been saying, putting up certain warning signals while not being alarmist, can we really say a second wave is here? Because linked to this, the fact is the fatality rate is down in the new infection. So is this a milder strain that we are seeing? Is this a second wave as it is being described? Because the number of positivity, the positivity rate has increased in the last few weeks?
Yes, to your second question, is this the second wave? I believe indeed it is. This has happened across the world. It has happened across history. Even as we speak now, there's an incipient third wave in Italy and Germany, which might sweep across the European continent. So it is in the nature of the virus. It is an intrinsic feature of the pandemic that it does come in multiple waves.
But isn't it milder? Isn't it milder with fewer infections and many of them asymptomatic?
Let's not be too certain of this, Rajdeep. I just want to take you back to exactly a year and 1 week ago. Your channel has been at the forefront of reporting on the pandemic, and you may recollect that I did an interview with you a year and a week ago, and there was a lot of reassurance in that. And at that time, there were just 84 cases in India and 0 deaths. And I did pull out some data and graphs and mathematical models to indicate that the picture was not that rosy. You agreed with me, though some of the panelists did not. And I believe it's time for us to look at the data again. It's time for us to be cautious. Optimism is a great thing. It makes us feel wonderful, but optimism in an overdose can have toxic side effects.
Let me take that to Dr. Jamil. Dr. Jamil, do you see a second wave or a very different kind of wave, if at all there is one, much more localized in certain states and in very, very hyper-localized areas even within those states? Are we seeing a hyper-localized, weaker second wave?
Well, there are certainly increase in cases in many parts of the country, especially 6 or 7 states, over the last maybe 4 weeks. The number of cases there have increased by anywhere from about 150 to 500%. To say that it is weaker, I don't think there is enough evidence. Certainly the case fatality rate has not increased. The case fatality rate, if at all, has gone down a little bit. There is also no evidence to suggest that it's a new strain of the virus, because the genome sequencing data that is coming out has not really been linked epidemiologically either to the spurt in infections or the fatality. So as far as we know at this time, it's the same virus.
Right.
But we need to be cautious. We need to be careful. And all these half measures of having night curfew and all really make no sense.
So you don't. So
the virus
no, are
doesn't
you
come
saying
out
we
at
go
night.
back to re-lockdown? Are you saying, doctor, we should go back to
No,
re-lockdown?
I'm not saying that. I'm not saying that. All I'm saying is that everyone is making an emotional response. People are not thinking through this. There are only two tools available to us to protect ourselves. One is COVID appropriate behavior, and the second is vaccine. We are worrying ourselves to death over, these blood clots, this and that. But at the same time, we are not wearing masks. So this is not logical at all.
Very interesting
Let's think through it.
Very interesting the way you're putting it. COVID appropriate behavior is much more important than having night curfews or temporary lockdowns in a few places. Dr. Arvind Kumar, just a couple of minutes. The next question is to you, which is interestingly being asked by a number of people. Should the general population also now be allowed to take the vaccine? Is our vaccine drive too restrictive at the moment? Why can't I, as a 55-year-old with no comorbidities, also take the vaccine? Has the time come to push faster?
I totally agree with this observation, Rajdeep. I have myself been saying that now time has come where more and more centers should be allowed to dispense this vaccine, and this restriction to over 60 or 45 to 60 with comorbidities should actually be removed, and a free availability of vaccine and all efforts by all agencies to inoculate as many people as fast as possible will probably be our best response to this second rising wave of corona.
Very interesting question, Dr. Thakkar, has come from Mr. Ganapati in Chennai. He says a hospital that gave ASTRAZENECA or the Covishield vaccine as a first dose is now offering only Bharat Bio, that is Covaxin. What should a patient do? Interesting question. Can I take Covishield first dose and Covaxin second? Surely not.
So this is a theory which a lot of scientists have been trying to propound, where you combine two vaccines to get better efficacy, but we don't have scientific data. I want to question that hospital why they are not giving the second dose of Covishield. I hope they are not fallen prey to this propaganda coming from the West, because one swallow does not make a summer, and the hospital should not be more Catholic than the Pope and give up the Covishield vaccine. I think the evidence currently today is both vaccines from the same family should be used. There are experiments going on about mixing one with the other, but we don't have data. And when we are looking through a microscope at side effects, I don't want to try anything unwarranted.
Okay, I think all of you typically, like quality doctors, have given so many clear messages that I think our viewers will be enriched by listening to you all. You've made it clear blood clotting is not an issue. Don't worry about it. Go ahead, get yourself vaccinated. But even after vaccination, follow COVID appropriate protocol. Keep the mask, the social distancing on. The battle is still on. We don't know whether it's a second wave as yet or not. But vaccination is an important step forward, and we still don't know how long the immunity will last, but it is certainly better than not getting vaccinated. To all four of you doctors, I appreciate you joining us on our Doctors Roundtable this evening. Thank you very much, as always, for your insightful comments. Thank you.